Hi, this is Vipul Chitalia. I'm associate professor in the Department of Medicine. My research focuses on cardiovascular complications and health disparity in different disease models. In this case, we examined cancer-associated venous thromboembolism. So, Brian, next slide. It is known that patients with different types of cancers are at higher risk for venous thromboembolism, which is deep vein thrombosis and leading to pulmonary embolism. And VTE is also the second highest leading cause of death, non-cancer related death in the cancer patients. So this particular event has a bearing on patient survival. Also, it is shown that if a person develops VTE with cancer, then there is less chance of survival, overall survival of this patient. So that implies this clinical event is quite significant in terms of morbidity and mortality in cancer patients. Yet, there is very little known about influence of race in this complication. Next slide. And this is important to study because vast majority of US population in next 40 years will consist of minority patients. And the way we currently predict cancer associated VTE does not incorporate race as a factor. And it is also clinically important because there are different therapies which are developed. It's important to now predict with accuracy those patients going to develop cancer associated VTE. So what we have done at Boston Medical Center, next slide. So we examined the influence of race in BMC population from 2004 to 2018. We had 16,500 patients of different types of cancers. And the left side of the slide shows overall baseline characteristic. And there are important points to be made here. So first is that in our cancer cohort, we had equal representation of male and female patients. And race is also important to highlight. So almost 50% of our patients were non-white. They consisted of blacks, which were 33%, and the rest is others. And we saw a huge array of different types of cancers in these patients. If you go to the on the left table, the lower part, it is also important to note that most of these patients were in the early stages of this cancer. On the right side, what we have shown is that what is the difference between the cancer types in white and black patients, and if this difference is significant. So you can see here that white patients had a higher prevalence of lung cancer compared to blacks. However, rest of the cancers were more prevalent in blacks compared to white. And the right lower panel of table is actually those patients with cancer with venous thromboembolism. And you can see that black and white patients are matched on several parameters. The only difference is their ethnicity. So black patients had double the risk or prevalence of VTE compared to white patients. So if you go to my next and concluding slide. So here we did a risk model in patients of lung cancer. And you can see in the table that black patients were at close to threefold higher risk of VTE compared to cancer. So, so in conclusion, this our cancer cohort was quite striking, given that it had similar distribution of white and black patients. Black patients were associated with higher risk of VT in cancer and almost up to 2.7 fold. So this basically highlights for the first time influence of race in cancer associated cardiovascular complication. Thank you.